All right, good morning, everyone. My name is Riaz Mahmood. I'm currently the chief resident at Northeast Georgia Medical Center, and I'm going to be sharing a case of starting Dapagliflozin in a patient with which is an SGLT2 inhibitor in a patient with an LVAD. So we just wanted to kind of share this idea of starting SGLT2 inhibitors in LVAD patients. These patients were traditionally excluded from clinical trials when they were conducted. So this was a 67-year-old gentleman that presented to our facility for an elective LVAD implantation. He had a history of non-ischemic cardiomyopathy. At that time, he was New York Heart Classification Class 2, ACC, AHA Stage D heart failure. He had been on optimized on medical therapy since 2014. He also had a CRT, which is cardiac resynchronization therapy, in place as well, which is a defibrillator on both sides. And so his last echo showed an EF of 20%, which was stable. And then he had a coronary angio, which did not show any obstructive coronary disease. He had a patent distal RCA stent placed a while back in 2009. Patient underwent successful LVAD implantation. And then on day of discharge, we started him on Dapagliflozin 10 milligrams on that day, and then he went home, and then he followed up the next day for outpatient lab workup for us. And then 4 months later, unfortunately, so he was given sort of the 4-month supply as a courtesy. And then after that, he was unable to afford it because his insurance did not approve the medicine. So he had to be taken off of it. And then he's been doing so well. So this was in 2020. So about 2.5 years later, he's been doing well enough that he's now being referred for transplant. And initially, the LVAD was implanted as a destination therapy. So as you can see in the middle, the table shows you what his labs and his blood pressure and everything looked like from day 0, which is the day Dapagliflozin was started, to day 104, so almost a little bit over 3 months. So if you can look at pretty much most of the things stayed fairly stable. There was a little bit of fluctuation. So for example, his creatinine did go up, but it would stay below 1.10 really for the most part. There was one reading was 1.13, but stable creatinine, stable sodium levels, stable potassium levels in the range around 4. So what we want to share is that it's a safe thing to do, especially in patients that are undergoing LVAD at that time of implantation. It should be considered starting an SGLT2 inhibitor. So, and then the right side, so my right side, or towards the right side of the diagram, you can see some of the effects of how SGLT2 inhibitors work to reduce the workload on the heart and improve outcomes. In conclusion, there's no clinical data, there's no clinical trials that have been conducted to look at SGLT2 inhibitors in LVAD patients. So given the benefits of SGLT2 inhibitors, we recommend considering starting this for patients that are undergoing LVAD and at that time, at time of discharge, and then following them up the next day and a week later, just to follow their lab workup to ensure that it remains safe. Thank you so much.
Great presentation. My question is, I know with the clinical trials for the SGLT2 inhibitor, only significant adverse effects were hypertension and AKI. For particularly day 79, it looks like his blood pressure was in the 80s. Was he at that point symptomatic? And let's say if he was, what would you guys have done?
So if he was symptomatic, we would follow the standard protocol. So for him, he was also started on Entresto and some of the other medicines, and they were being titrated up. So that was the reason for that blood pressure drop. So we had to go down on his titration of his Entresto dose. So we felt that that was the reason. And then if you noticed, when he came back the next time around, his blood pressure came back up. And he was still on the SGLT2 inhibitor because he was on it for 4 months. So we're fairly confident in saying that that's safe to do. because if you notice, he didn't really develop an AKI, no severe kidney disease or anything like that. And his blood pressure did fluctuate a little bit, but it stays fairly stable except for that one reading.
Was there any improvement in ejection fraction after initiation of SGLT2?
No, so unfortunately, I mean, he stayed below 20%, which is why he's now being considered for cardiac transplant.
Any other questions? Thank you.
Thank you.